Okay, so basically we will do cellulitis. It is very a painful swelling of soft tissues, means it is basically a swelling of the mouth or face soft tissues that is either by the spreading of that pus along the facial planes that separate the muscle bundles. In upcoming video, okay, on this you can see these spaces. On this, in these spaces, when the pus or abscess spreads, so it causes the inflammation of that area. Okay, it is spread in that. It is not well localized. Number one, it rapidly spread. Basically, the streptokinase and hyaluronidase are released by the stains of streptococci. Okay, basically, clinical features very important again. It is a diffuse because it is not localized. It has a very tense, painful swelling, involves soft tissue. Patient has malaise and elevated by temperature. Swelling is due to, of course, inflammatory edema, and suppuration means the pus is there. There's a swelling and there's of course pain. Cellulitis is the maxillary teeth. Initially involves the upper half of the face. It does might have not that much with the mandibular. Okay, basically one important thing, it was the extension is towards the eyes, has a potential because the inner canthus, it is actually the inner axis of the eye, it is actually communicated with the governor sinus. And when in governor sinus there is the, because when the fluid or the pus that enter in that governor sinus, so it will cause infection to the eye. So basically, okay, cellulitis also is basically associated with the mandibular teeth. Initially, then it will evolve the lower half of the face. Basically, submandibular and cervical nodes. If it involves some mandibular and cervical tissue, so it can cause the respiratory embarrassment. Okay, it can also the cellulitis spread to the deeper surgical spaces, cause pain clinically and tremors rather than facial swelling. When it moves to the deep surgical spaces, it will cause tremors. The patient will unable to open its mouth. It can affect your eye because the governor sinus is connected to the inner canthus. Number one. Second, when it spread to the submandibular region, your cervical portion, it can affect your respiration. Third, when it goes to the deep surgical spaces, it can cause pain, but the one important is tremors. When a patient cannot open, the patient will does not have the facial swelling, but the patient will have a pain and tremors. The patient will not open its mouth. Okay, you can see not that much clear, but now moving towards the long wings angina. Long wings angina means when the pus spread into the floor of the mouth. Okay, second, it is the severe form of cellulitis. Submandibular, sublingual, submandible spaces means the floor of the mouth. Submandibular, submental, and sublingular. That is basically result from the initial involvement of submandibular space. In other words, it is a very life-threatening form of cellulitis. Number one, it is a form of severe cellulitis involving submandibular, submental, sublingual. That is, initially it involves the submandibular space. It is a life-threatening condition of cellulitis. It was the name comes from that the Ludwig was a scientist, and angina means then a feeling of strangulation. Strangulation. Okay, you can see this is the buccal space, some mandibular space, and then some lingual and some mandibular space. In this, it can spread. Okay. Number one, causes again abscess in the molars and premolars, and infection, dental infection. Okay, in the molars. Then mandibular fracture. Okay, one important, some mandibular salidentitis. Okay, means inflammation of the salivary glands, of the submandibular salivary glands inflammation, so it's called salidinitis. Cellulitis. Okay, number one, matlab causes, it can be abscess in your molars and premolars, mandibular fracture, or some mandibular basically cellulitis. Organisms, as we have said, cellulitis and strepto means it is a alpha alpha hemolytic streptococci, staphylococci, and bacteroids. Both strepto is involved, staphylo is involved, and bacteroids. And in causes, when it comes to that, it can be abscess in your molars and premolars, or either mandibular fracture, or either some mandibular salinitis. either by salad, salidinitis. Okay. Clinical features: the patient will have what? Of course, it is involving your submandibular, sublingual, and sub mental spaces. So basically, there will be a swelling of the floor of the mouth, the broad swelling of the floor of the mouth. The tongue becomes elevated and displays posteriorly, so it can cause, because of that, it was causing what? Difficulty in breathing. It will cause difficulty in breathing. The patient will, it will difficulty in breathing, in swelling. Okay, so when it is elevated, they are displayed, the tongue posteriorly. Again, in cellulitis, we have said it has a respiratory difficulty. Patient can cause, the patient can have eye infection, stress, muscle. Again, it has this features, and in Ludwig's, patient has difficulty in breathing and swelling. Of course, again, because of that, eating and swelling and breathing is hard. TK, when the infection is worsened, it can move towards your pharynx and larynx. Again, edema of the glottis may result. Okay, so patient can, will have suffocation when the glottis that open, that close the that lead, when inflamed, the patient can have suffocation, drooling, and trismus. Again, treatment: IV fluids you have to give. Okay, IV fluids. Okay, antibiotics for, of course, gram positive bacteria, metronidazole for pain, incision and drainage. If localized, you have to do. And tracheotomy, you will open the trachea. You have to open sinus tract terms. Basically, what you have said, it is basically a pathway, a drainage pathway from a deep focus of the acute inflammation to a, through a tissue, bone, or bore to the opening on the surface. Basically, it is a drainage pathway from a deep foci of infection through a tissue. When you, okay, through that, you remove the, or drain the infection, or that, from a tissue, from the tissue of bone, or both, by opening on that surface. Okay. Now, parolis basically a nodule on the gingiva at the side where the drainage tract reaches the surface. Means it is, you can see it here. Prolis is basically when there is a nodule on the gingiva. You can say it is pedunculated nodule. Sessile. It is a sessile nodule on the gingiva at the side where the drainage of the sinus tract reaches the surface. Okay, pustula basically it is an abnormal communication or drainage pathway between the two epithelium lined surfaces. Because of the destruction of intervening tissue is destroyed, and there is a communication between two epithelial lined surfaces. Oro intrafistula. The abscess basically erodes the maxillary sinus and destroys the intervening bone and lining, and a funding tooth is extracted. Basically, the communication is between, again, through a sinus and oral cavity results, and the tract may remain permanently open, and it is called oro intrafistula. The oro, it is basically erode the maxillary sinus, destroy the bone, even the lining of the tooth that has been extracted. This is the communication between a sinus and oral cavity, so it is called orointrafistula. Okay, it is not that much important. Orointrafistula means a path of communication between a sinus or oral cavity. Now, some true false. The radiographic appearance of osteomyelitis, which I have not studied with you, don't worry. After stripping the bone periosteum, the pus can track in several directions. Yes. Governous sinus thrombosis is a complication of, no, it is the complication of the cellulitis.